Adolescent health, the social determinant of education. Social determinants are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the state of daily life. According to the World Health Organization, these determinants can be more significant than healthcare or lifestyle decisions in influencing health. While positive social determinants can enhance and promote optimal health outcomes, when a lack of resources or barriers arise, social determinants can create disparities which can significantly impact knowledge and accessibility to healthcare. Ending delivery of education has affected adolescents and their experience of COVID-19, amplifying its impacts on health and well-being. Education can be disrupted by various factors, including natural disasters, war, and disease. This is just demonstrated by the transition from traditional face-to-face classroom education to emergency remote learning that was instigated by government institutions internationally upon the outbreak of COVID-19 pandemic. According to the 2020 Mission Australia Youth Survey, 41% of individuals aged 17 emphasised that education was their most significant personal concern. This concern could have particular relevance to an adolescent experiencing other adversities during COVID-19 lockdowns. For instance, a 17-year-old female adolescent from a low socioeconomic background may experience further financial instability due to the redundancy of non-essential work during the COVID-19 pandemic. This economic strain may limit her access to an adequate internet bandwidth connection and appropriate technology. A lack of academic and social support in acquiring appropriate educational resources may prompt feelings of helplessness and isolation. According to the Australian Institution of Health and Welfare, 70% of adolescents said the pandemic response had also negatively affected their social connectedness with others. This may impact an adolescent's level of productivity, attendance, and engagement in their own education. The external stresses that COVID-19 has augmented include loss of employment and income in conjunction with the unique challenges of remote education. Resultantly, severe psychological distress for adolescents aged 15 to 24 has increased from 14% in 2017 to 22% in 2020. Without appropriate support systems in place for adolescents, behaviour and lifestyle risk factors may be elevated, increasing the risk of perpetual long-term effects. The
Without
COVID-19
appropriate
pandemic
support
has increased
systems in
exposure
place
to
for
behavioural and
adolescents,
lifestyle risk
behaviour and
factors,
lifestyle
increasing
risk
an
factors
adolescent's
may be
susceptibility
elevated,
to long-term
increasing the
impacts on
risk of
health
perpetual
outcomes.
long-term effects.
During this period, adolescents
The
are more vulnerable
COVID-19
than any other
pandemic has
demographic
increased
to unhealthy
exposure to
lifestyle
behavioural and
behaviours.
lifestyle risk factors,
The outbreak of
increasing an
COVID-19 has
adolescent's
impacted
susceptibility
these
to
risk
long-term
factors by
impacts
increasing
on
the
health
likelihood of an
outcomes.
adolescent developing these lifestyle behaviours.
During this period,
To cope and
adolescents are more
regain some sense of
vulnerable
control
than
during these
any other
unprecedented
demographic to
times.
unhealthy lifestyle behaviours.
The lifestyle behaviour alcohol consumption has been on a steady rise since the COVID stay-at-home orders were initiated. Although underage drinking has steadily decreased over the past decade, according to the National Survey on Drug Use and Health, 33.5% of teens in 2020 said they drank regularly, which is the highest statistic since 2009. Despite lockdown restrictions minimizing social drinking with friends and peers, a study conducted by the Journal of Adolescent Health delineated that 16% of parents and guardians relaxed their no drinking policy during COVID-19 lockdowns. Permitting alcohol consumption in adolescence emphasizes a loss of discipline in the home environment and encourages adolescents to utilize alcohol as a coping mechanism in response to the stresses, loneliness, and boredom of remote learning. Subsequently, the increase in this risk factor of alcohol consumption can lead to various long-term impacts. These long-term impacts include the development of mental health conditions such as depression and anxiety, alcohol addiction, malnutrition, liver disease, gastritis, mouth and throat-related cancers, and cognitive impairment. Despite the increased risk in adopting unhealthy behaviours in response to these external stresses, these impacts can be minimized through the support of a primary healthcare nurse. The role of a primary healthcare nurse is to empower, educate, and provide support for individuals experiencing decline in health and well-being. Patient-centered primary healthcare nurses can provide support to an adolescent experiencing deterioration in physical and mental health,
such as stress
by
management
providing
techniques,
education on
as well as
self-care and
providing
referral services.
education and overviews on referral mental
Patient-centered
health
approaches
services,
could
such as
involve
Beyond Blue
providing
and
information
Headspace.
and health promotion
Additionally,
on general
assistance could be
self-care
provided to
regarding
adolescents
stress management
experiencing
techniques,
limitations
as
in
well as providing an
financial income and
overview of
education
referral
through
mental
referral
health
to a
services
social
such as
worker
Beyond
who
Blue
can
and
provide further
Headspace.
support to individuals
Additionally,
experiencing
assistance can be provided to
marginalisation and
adolescents
disadvantage.
experiencing limitations in financial
Primary
income and
healthcare nurses
education
can also provide
through referral to a
interventions
social
to
worker
initiate
who can
behavioural
provide
change within
further
an
support to
adolescent,
individuals
who is susceptible
experiencing
to behavioural risk
marginalisation and
factors.
disadvantage. Primary healthcare nurses can also provide interventions to initiate behavioral change within an adolescent who is susceptible to behavioral risk factors. These interventions can include motivational interviewing, which, according to the National Library of Medicine, is a robust evidence-based intervention used to evoke intrinsic motivation to resolve unhealthy behaviors. This approach can be applied to the increased alcohol intake of an adolescent in response to the loss of stability in education and economic income. For instance, in the context of alcohol abuse, a primary healthcare nurse can encourage patients to form a balanced perspective by weighing up the pros and cons of making a change. Then, time is spent where collaborative planning and education can be offered on how the changes can be made. After the change is made by an adolescent, with support from their family and the primary healthcare nurse, follow-up and further monitoring of the process may be required in the event of barriers to progress and relapse occur. This strategy can significantly impact health outcomes by facilitating beneficial lifestyle changes and preventing the onset of long-term chronic disease. A primary healthcare nurse plays an indispensable role in providing referrals, health promotion, as well as interventions to overcome inequities and social determinants, thus promoting the holistic health and well-being of adolescents.